G'day and welcome to our latest video on what I classify is the forgotten organ, and that's the kidneys. So why the forgotten organ? Well, most people know that the kidneys help to remove poisons and toxins from the body, and it does that by putting it into the urine and out it goes. But it runs a distant third behind the importance of the colon. So people go, oh, I've got to do a colon cleanse, or I've got to do a liver detoxification. They're the two organs that generally people focus on to improve the body's ability to remove toxins. And they kind of forget about the kidneys, which is a bit of a shame, because if I cut the liver in half and threw half of it away, it'd regrow, right? If I did that for the kidneys, you've got half a kidney less. So very important to keep our kidneys healthy. And not only do they filter, but they also do other important roles within the body. So they sit just behind the lower part of the rib cage at the back, and they're about the size of your hand. There's two of them, there should be two. And they filter toxins by, the kidneys are fed by a renal artery, which is a big artery that comes down, feeds both kidneys, and off from those renal artery it branches off to little tiny blood vessels called capillaries. Those capillaries then feed a particular kidney cell called a nephron. The role of the nephron is it has some other blood vessels in there, a group of blood vessels called glomerulus. When the blood enters that glomerulus, it allows small particles like toxins and poisons and acids and bases to pass through its membrane into a tubule, which is like a tube. It's a collection tube for the toxins with a little bit of fluid that drips down then through the tubes down into the bladder and fills the bladder, and you go to the toilet, empty your bladder, toxins removed from the body. But it also does a lot of other important stuff in the body. So one of the important things it does is it produces new red blood cells. It tells the body to produce new red blood cells. And because if your blood flow to the kidneys decreases by 30%, which either means that you're bleeding out or you've got blockages that are stopping the blood flow to the kidneys will release a hormone called erythropoietin, or EPO, and then that travels to the bone marrow and tells the bone marrow, needs some more red blood cells. Come on, let's go. And so then the bone marrow produces more red blood cells with more oxygen and helps to keep the blood volume up to the kidneys, which will increase the blood flow to the kidneys. EPO was banned in sport for that particular reason. So cyclists used to use a lot of EPO because it increased the amount of blood, which is the blood volume, which increased the oxygen, which increased the strength, which increased the endurance. Not good for an athlete, so they banned that. It also regulates our pH, so our blood pH should be between 7.35 and 7.45. If it gets too high, we become acidic, very sick. If it comes too low, alkaline, very sick as well. So how it does that is that it will remove acids from the body if we're too high, and it will remove bicarbonate, which is produced by the lungs and the pancreas, if we get too alkaline. So it keeps that balance, so very, very important. It also regulates our blood pressure. So, as I said, blood flow to the kidneys is very important. If you don't have good blood flow to the kidneys, you do not filter properly. So, the kidneys go, oh, I've not got enough blood flow, I've increased the EPO, and it's not really done it, so we need to tell the heart we need to get some more blood pressure. So it secretes a hormone or a chemical called renin. That renin travels in the blood, goes to the liver, and the liver goes, oh, renin, I'll convert you to angiotensin 1. And it does that, and it sends it on its way, and it goes to the lungs, and the lung says, I'll convert you to angiotensin 2. Travels throughout the blood, goes down to the adrenal glands. The adrenal glands go, oh, angiotensin 2. That means I must produce or release aldosterone. So once aldosterone is released into the bloodstream, it tells all the blood vessels that were big like this to constrict. Once they constrict, the heart's going to have to work harder. And so the heart starts to pump, okay? And push that blood pressure throughout the body, so more blood can then flow to the kidneys. It also regulates our fluid, so if we're dehydrated, it will retain fluid because we will die. And if we're nice and hydrated, it will release fluid, so it will reduce our fluid as well. It balances our electrolyte levels, so our sodium, potassium, calcium, chloride, etc. If we've got too much, it will excrete it out via the urine. If we don't have enough, it will retain it. It also converts the vitamin D that we get in our food and from the sunlight to its active form, which is calcitriol. So that's quite important because vitamin D is a potent immune stimulant, anti-cancer, calcium back into bones, quite important. So they're the roles that the kidneys do. But what damages the kidneys? Now this is quite important because people go, oh, kidneys, they're sitting here, you don't even think about it, you don't even give them a second thought. But once they start to fail, it's very hard to push the proverbial back up the hill, right? So I'm very passionate about keeping the kidneys healthy for our long-term health. So I'm going to explain to you what damages the kidneys, and you can go, oh, I do that, maybe I shouldn't do that, and maybe I should modify my life or do this or do that and keep my kidneys healthy. So what damages the kidneys? Number one, blood pressure. Hang on a second, didn't you just tell me that the blood, if we haven't got enough blood flow to the kidneys produce blood pressure. Or they tell the body to increase blood pressure. And yes, that is true. But normal blood pressure, garden hose. Blood pressure when the heart's pumping at 160 over 90 or something like that. It's like a fire hydrant. And that pressure comes down to these little capillaries and these little nephrons and goes, it's like Apollo Creed knocking Rocky Balboa around the head, and it's punch drunk and it doesn't work effectively. And that can either severely damage that cell, kill that cell, or just render it useless, punch drunk, and it's not working properly. So then you've got a million nephrons, and the high blood pressure has just knocked it down to 750,000. That's 250,000 that aren't pulling their weight. That's more work that the rest of the kidneys have to deal with, and I'll come to that in a minute. Diabetes, whether it be type 1 or type 2, also causes kidney damage. Why? Because the elevated blood sugars damage the arteries. So then that can cause those arteries to become narrower, harder, so they're not flexible. Then that drives up blood pressure as well. Smoking's not good for anything, but in the case of the kidneys, smoking causes renal stenosis, which is narrowing of the renal artery to the kidneys. Okay, so obviously lack of blood flow, that drives up blood pressure. Obesity, a couple of things. So firstly, if you've got the abdominal obesity, you've got fat around here, you've got your renal artery feeding the kidneys. If that fat compresses, can only go out so far, it's all around all your internal organs, and that pushes on that blood vessel wall, that's then a lack of blood flow, up goes blood pressure. People with obesity are more prone to metabolic syndrome, which is blood pressure and diabetes in combination, and cardiovascular disease. So, both those things we've just mentioned. Memory blank. I was going somewhere, I'm sorry. It's just like so much information in my head, and it comes here and they just go, yeah, what next? I don't know. Everyone's standing around looking at each other upstairs. Inflammation to the kidneys. So anything that can cause damage to the kidneys, whether it be drugs, alcohol, lack of antioxidants, infections, anything that damages the kidneys, in particular the glomerulus, which is those little blood vessels, causes the kidneys not to function properly. Polycystic ovary syndrome. Well, not really. Polycystic kidney syndrome, which is multiple cysts within the kidneys. If your kidneys are this big and you've got all these cysts poking around here in the kidneys, that means that the nephrons are either they're squashed or they're just blocked off completely, and that means they're not working. So that million down to 750,000 again. Lack of ability to filter the toxins out of the body effectively. Any kidney type infection is going to cause damage, especially long-term kidney or urinary tract type infections. Anything that obstructs the urine flow is going to damage the kidneys. Now, if you think of it, if the kidneys filter all the toxins of liquid down into the bladder, and then from the bladder, then that goes out of the body, but you've got something obstructing that then urine kind of builds up and 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 gets to that level, and the kidneys say, I got the stuff coming in, I ain't got anything going out, we're in trouble. So what causes obstruction of the kidneys? Men, enlarged prostate, right? Benign prostatic hyperplasia, which means that the prostate swells, gets bigger, easy to fix, lots of herbs and nutrients that will sweep that, but that's another story for another day. Kidney stones, bladder cancer, colon cancer can all obstruct the flow of the urine out of the bladder. So important to make sure, good stream, good flow. Alcohol, damages the kidneys. It also inhibits the antidiuretic hormone. So there's a hormone that regulates that fluid, and it's called the antidiuretic hormone. So if you've got good levels of antidiuretic hormone, you're not piddling. Now, how many times have you had a couple of drinks, and a drink, and a drink, and a drink, 3 drinks, all of a sudden, got to go to the toilet, sit back down, get up, go to the toilet, sit back down, get up, go to the toilet, piddling all night. That's because you've inhibited the antidiuretic hormone, so the body can't produce it. So alcohol, well, it produces it, alcohol just stops it from happening. So that means you're just piddling, wake up the next day very dehydrated. And then there's the oxidative stress. So oxidative stress is rust that occurs to any cell in the body, in particular the kidneys. Antioxidants are the things that are the galvanised paint that protect those cells from rusting. Junk food diet, any foods with preservatives, additives, artificial flavours, artificial colourings, artificial sweeteners, kidneys. They've got to filter all this sort of stuff out. That sort of diet is low in antioxidants. Antioxidants are foods that are reds, purples, greens, orange, yellows. I ain't talking about that Smarties or M&Ms here. I'm talking about real food, natural food, Mother Nature's medicine. So a diet, full of sugar, again, sugar damages the blood vessel walls. White flour products, all converted in the body to glucose, damages the blood vessel walls. So a diet rich in nutrients, which we'll come to later on. Anyway, pharmaceutical medication. Oh, hang on, do they damage the kidneys? Oh, bugger me. Yes, they do. So certain ones, not every single one, but certain ones. So antibiotics. Antibiotics form hard crystals. A lot of antibiotics form hard crystals in the blood that have to be filtered out by the kidneys. Now they're sharp, they can damage the nephrons, or they get blocked and they can't be excreted properly. So they will cause kidney damage. As will non-steroidal anti-inflammatories, so aspirin, Nurofen, Naproxen, Mobix, Celebrex, Vioxx, they actually damage the nephrons, so that the little filtering cell, I forgot what the hell that was, little filtering cell within the kidneys, the nephron, that damages that, and so that body's not filtering properly. Protein pump inhibitors, which I mentioned in my last video on reflux and how they had a big increased risk of dementia and cancer. They actually increase the inflammation within the kidneys. So if you twist your ankle and it's swollen and it's inflamed, so any inflammation will cause swelling. So your foot, your ankle doesn't walk properly once it's inflamed and swollen because you can't walk on it. Well, the same thing happens here. If they're inflamed, they're not going to function properly. They're not functioning properly, toxins build up. The liver's starting to get very annoyed with you because it's going to have to pick up your slack. Certain blood pressure medication, ACE inhibitors taken over a period of time can damage the kidneys. Diuretics can also damage the kidneys. So people that have got high blood pressure are generally on a diuretic to help the body remove the fluid because they're not removing the fluid properly. But diuretics can then lead to dehydration, which then causes the build-up of the baddies back within the blood. So there's certain blood tests and urine tests that can be done to show the function of the kidneys. So one of the common blood tests that your GP will do is creatinine. That is the breakdown of muscle, and it's filtered out by the kidneys. So if you've got your creatinine levels rise, that means the kidneys are not filtering that effectively. Another one is albumin. That's generally a urine test, and albumin is the protein from blood. So when you have a pill, you're not necessarily going to see a whole lot of red. Actually, if you do see a whole lot of red, go straight to the hospital, go straight to emergency. But generally you won't, and it'll be just normal colour. Now what normal colour is, which we'll come to in a sec, sorry. I'm going to digress myself, got all the too much. So there's a protein. If they find that in the urine, that means that your kidneys are damaged and they're bleeding, or they're not filtering effectively. And so they're two really good tests. So if they're elevated, that will tell us kidneys aren't working properly. There's another one, which is the glomerular filtration rate. And on a blood test, it'll be eGFR. And if your glomerular filtration rate, so that's those little nephrons that I was talking about earlier on, that's how well they're filtering, right? Now, if they're above 90, sweet, everything is great. You've got really good kidneys. If they drop down to between, I think it's 60 and 89, you've got stage 2 kidney disease. If it's drops down. I can't tell you that there's stage 3, there's 3A, 3B, 4 and 5, I think the different stages are. If your glomerular filtration rate drops below 15, you're pretty much screwed. You have to either go on dialysis, which is a machine that will filter all your blood and put it back in, cleanse it and put it back in, and you've got to do that a couple of times a week, if not daily, or you're on the thing for a kidney transplant. If you don't do either of those, you're building a box and digging a hole. So those tests can show the kidney function, as can urate or uric acid as well. So if they're elevated, that tells us that the kidneys aren't filtering those things out effectively. Now, urine. When we piddle in the morning, it's generally a darker brown colour because we haven't piddled all night and it's collected there, it's concentrated and out it goes. But really what we want to aim for is nice, throughout the day, is nice, clear urine. Not frothy. If it's frothy, there can be a problem. Now, if it's nice, clear urine, that means you're nice and well hydrated and your kidneys are flushing that out effectively. Now, when I talk about that, I'm going to go back a step. So, some of the signs and symptoms that the kidneys, not necessarily even blood tests, but some signs and symptoms that the kidneys mightn't be functioning 100%. Lower back pain, your kidneys are sore because they're having to do a lot of toxic work. They'll remove a lot of toxins, do a lot of extra work. Osteoporosis, osteopenia, kidneys play a vital role in getting calcium back into your bones. So in Chinese medicine, poor kidney function equals poor bone function. It also causes ringing in the ears and deafness, right? So there's signs that the kidneys mightn't be working as effectively as they should. Snoring, vertigo, dizziness, all signs that the kidneys are not working properly. Too much urine, too little urine, dark urine, cloudy, frothy, I said bloody before, urine, all signs that the kidneys aren't working properly. Dry skin, itchy skin, fatigue, I've forgotten. I should know this, shouldn't I? Anyway, there's a whole heap. Generally old people's disease, arthritis, hip replacements, knee replacements, they're all signs that the kidneys aren't working as effectively as they should. Okay, there's all the doom and gloom, and there's all the things, and we've known about the pharmaceuticals, we've known about our lifestyle thing, we know about our weight and our smoking and all that sort of stuff. What can we do to help improve our kidney function? Well, if you're overweight, you're going to lose the weight. Right? You've got to find some way of losing weight. That ain't, stomach surgery. It's physically losing the weight. It's either changing your diet, exercising, getting your hormones regulated, reducing inflammation, fixing up your gut. Whatever it is, you've got to do that. You've got to look after your kidney health. So that's number one. If you smoke, enough said. If you're a heavy drinker or you drink a lot, enough said. You've got to stop all those sort of habits to keep your kidneys healthy. There's no use when you're stage 2A or 3A or 3B going, oh, bloody hell, I better do something. Panic. It's now. It's now we've got to do something, because I want to live to 100. I don't want to be kind of like dragging me butt around at 70 because I'm dragging a dialysis machine with me, or I'm heading off to the hospital every second day to get dialysis, or I'm waiting to get a kidney transplant. It's just not a life to live. Okay, so there's some really good foods that help improve kidney function. Now, the first one, it's one of my favourite, is watermelon. Now, why watermelon? Well, firstly, it's full of water, and secondly, it's full of electrolytes, which is very important, sodium, magnesium, potassium, and all that sort of stuff. And thirdly, it's high in antioxidants. So those antioxidants, as I've said, protect the cells from damage. They keep the nephrons and other cells within the body really healthy. Beetroot is another classic kidney tonic. I'm not talking about the tin stuff, I'm talking about the fresh stuff. Besides being very purple, potent antioxidant, it also helps to nourish the kidneys. Beans do that as well. Now, there's a certain bean called a kidney bean, and a lot of all beans are shaped like a kidneys, and in traditional foods, in traditional cultures, beans were always classified as a nourishing kidney food. Parsley, diuretic, very high in antioxidants as well. Celery, diuretic. Coriander, diuretic. All great kidney regenerative herbs, or foods, I should say. Well, they are herbs actually. They're both culinary herbs. We use them in the kitchen. People get a piece of steak when they go out for dinner, they get a bit of parsley on it, and they generally put the parsley over there and eat the steak. We need to eat the parsley. There's some fantastic herbs, and I use a fair few of these in the clinic to help nourish the kidneys. and I'll use that in a tonic called Kidney Support and Naturopath Kidney Support. And one of the herbs I love in that is astragalus. Now, astragalus in Chinese medicine is always been classified as a kidney tonic. It helps nourish and revitalise the kidneys. Now, if we talk about Chinese medicine, I'll digress a little bit here. If we talk about Chinese medicine, they don't see the kidneys as everything that I've just shown you. They see the kidneys as the storage of qi. Now, qi is, in Chinese medicine, is the energy that flows throughout every organ and every cell in the body. Now, the kidneys are the storage of our parental qi. So the qi that we've inherited from mum and dad is stored in our kidneys. And when through lack of sleep or stress or poor diet or whatever, we've depleted the qi in our digestive system or our lungs or our liver, the kidneys have got some store which they will feed and nourish the rest of the organs and the rest of the body with. So if we look at the way they are compared to that role of the kidneys there, that's a completely different way than Western medicine looks at it. Now, China's been doing this for about 5,000 years, so they kind of know a lot more than the last 150 years that we've been looking at it for. So I kind of always look at other cultures and see what they do with particular organs or health or whatever, because they've been doing it for a lot longer than we have. And so we've got studies and tests and all that sort of stuff, but nothing beats, traditional knowledge. So astragalus is one of those herbs to nourish and revitalise the kidneys. It also stabilises the glomerular filtration. So if you've got, stage 3 or 4 kidney disease, it will help stabilise that glomerular filtration. So instead of going down like that, down to level 5, it's going to help stabilise it. It still may drop down to level 5, but it'll drop down over a lot longer period. So very, very important herb there. Burdock, which Western herbalists have used for thousands of years, is a diuretic and a blood cleanser. So a diuretic helps flush the kidneys, which is quite important. Now, if we talk about diuretics, we've got the king of diuretics, which is dandelion. That weed that just grows out in our gardens and we're forever trying to dig them out and get rid of them. We should actually be digging them up and eating them, and eating the leaves, because the dandelion is actually a tonic for the kidney. So it's got full of vitamins, minerals and nutrients that actually support and regenerate and revitalise kidney function. It's also very high in potassium, which I will talk about because I've just realised something else. If you suffer from chronic kidney disease, digressing here, sorry about this, chronic kidney disease, which means your kidneys aren't filtering properly, you have a lot of difficulty removing potassium and phosphorus from the body. So you have to minimise those foods. So I've just mentioned dandelion's a really good tonic, but it contains a bit of potassium, so you might have to modify that. Bananas, potassium. Lots of foods contain potassium. Lots of foods contain phosphorus. Also, phosphorus is in as an additive, as a phosphate in foods. So you have to reduce those, because if they build up in your blood, because the kidneys aren't filtering them properly, you can get quite sick. Okay, sorry, digress. Back to where I was, dandelion. So dandelion nourishes the kidneys and helps remove kidney stones as well. Okay, dong quai, which in Chinese medicine is a kidney tonic, kidney, but in Western herbal medicine, we've taken it from China, but we would use that as a gynecological herb for women, so a herb to balance their hormones, and it does it extremely well. But it's also a herb that improves the cardiovascular system and the blood flow through the fine arteries and capillaries within the body. Hence why it's very, very important for the kidneys, because if you've got reduced blood flow to the nephrons and the glomerulus within the nephrons, those don't filter properly. Well, dong quai helps improve the filtering of those. It also, along with Romania and astragalus, helps to reverse renal stenosis, which is the narrowing of the arteries, the renal artery. So quite important there. Gynostemma is another Chinese herb. Actually, no, was that Indian? Oh, I can't. I could stand corrected there. But it's also another tonic for the kidneys. Clovers is a great diuretic for the kidneys. St Mary's thistle, people think, or milk thistle, they go, oh, that's for the liver. Yes, it is, because it helps the liver regenerate 4 times faster. So if you cut the liver in half and have St Mary's thistle, it will increase its ability to regenerate to full size 4 times quicker than it normally would. But with the kidneys, it actually protects the kidneys from congestion, so from toxic damage and congestion, so it helps remove those toxins more effectively. And when combined with dandelion, it protects the kidneys from drug and diet related toxins. So quite important herb there. So, and there's quite a lot of other herbs, and as I said, I can't remember them all. I most probably could if I sat down. Don't give me an exam. I'll most probably forget what I've just told you. Antioxidants, really important. Foods high in antioxidants, very important. Foods that are high because they protect the kidneys from the rust, from the damage. They're the galvanised paint. They protect those kidneys. Fruits, vegetables, any colours, herbs, nuts and seeds, legumes and pulses and beans, they all contain antioxidants. So do to seafood and certain meats, grass-fed or organic or wild-caught seafood, none of the farm grain-fed stuff. Very, very important, as is things like, and for that in the clinic, I would use Naturovital antioxidant support. And I would also, for my patients that I treat with kidneys, I give them Naturovital Green Cleanse. And why is it? Because it contains spirulina, barley grass, chlorella, wheatgrass, alfalfa, and they all gently cleanse, nourish, and their unique nutritional profile revitalises kidney function. Okay, so anyway, there's most probably a lot more that I should have told you, but the universe hasn't decided that I will tell you today, and you've been very, very good, and you have sat here and hopefully you've sat here and listened to me. So I do really appreciate that, and hopefully you've got a bit more knowledge and a bit more understanding of kidney function. So thank you for your time. If you like this video, please click like, share it on social media, subscribe to our channel so you can know when we've next released our latest video. Oh, good Lord, I'm talking double Dutch here, apologise. Anyway, you have a fantastic day, live life and laugh loud.